Good morning, everyone. This is Heiko from the Acupuncture on Air show on Radio Kidnappers. We're talking with Kane Hamilton from Hamilton this week. He is a practitioner in the Waikato region, and he specialises in seeing lots of women's disorders. Good morning, Kane. How are you?
Hey there, how are you doing today? Thanks for having me on the show.
Yeah, and how's the weather up there? Humid?
Well, 2 days ago it was freezing.
Yeah.
Probably one of the coldest mornings I've had, and I don't even think the fog lifted. So,
yeah.
But today's not a bad day.
Yeah, no, we had the same here. It was really took my car a while to get warm. So yeah, we've got an interesting topic today. We're talking about with in relation to women's problems and pregnancy, and it's not that many people even know about it, and also then are unaware that acupuncture can help for it too. But we're talking about acupuncture that's used during itchiness. In particular, it's quite common in the third trimester period.
Yes, sure. Yep. Yes, the last trimester is that's quite common actually. I've just had a lady 2 days ago with exactly this, and it can be very distressing for the mum as well, the mum to be, which really can place a massive impact on sleeping as well. And at this stage in the pregnancy, we really need to build the energy up as much as we can. So itching in the third trimester is not very good.
Now, from a Western medical perspective, well, what do they do? I mean, what sort of they go to the doctor and say, I've got the itch.
Well, yeah. I mean, possibly they would do steroids, maybe antihistamines, but many women these days really want to try and avoid any unnecessary drugs. Really, at any stage during the pregnancy.
Yeah, that's what I'm.
So they're a little bit shy of thinking about that line of treatment.
Yeah, that's what I'm finding as well. The women will tend to say, "Well, I'll just put up with it because it's not that long to go." But then often they're seeing me in that third trimester for something else, and then they mention the itching, and then I say, "Okay, well, we'll treat that as well." And but just tell us just for our listeners and our viewers now on YouTube, what's the sort of the Chinese medical diagnosis background? What causes the itching?
So obviously there can be more than one cause. Hence a detailed analysis of symptoms and diagnosis will ascertain like the pathology. But really the most common that we see in Chinese medicine is what we would call as blood deficiency and wind as the underlying factor here.
Now, what about this wind? Well, what do you mean by wind?
Well, this is how I look at it. It's in Chinese medicine, the blood fills the vessels, right? So if the blood is deficient, then there's nothing else to fill the gap. But from this point of view, the wind is what fills the gap in Chinese medicine, and this means that it can move from place to place throughout the body. So wind in Chinese medicine is actually considered to be the backbone of many diseases, and it affects it in the same way as, like, if you look outside, how wind, like, it can move the tree leaves involuntary. So itching can be the same as that. So it can move from one place to the next, and
that's a good
generate
analogy.
Rashes and joint pain or joint discomfort and things like that as well. So we would say it's a yang phenomenon. So it's a more moving aspect as well.
Are there sort of a number of different points, or a couple of main ones? In your experience, what do you say about the acupuncture points themselves?
Well, there are many points in Chinese medicine, as people know, but funnily enough, there are points that have actually wind in their name, and one of the major points we use is we would say gallbladder 31 or wind market, so to speak, or feng shui, which is, my Chinese is not that good.
Yeah.
So but feng is the wind as well. So, and therefore that means it dispels the wind or activates the meridian, and it can help relieve the itchiness. And this point is an empirical point, which means that it's safe in pregnancy as well, and it's in the mid aspect of the leg.
Now, are you doing any acupuncture points in the belly itself of the pregnant mum?
No, that's the good thing about it, is that we are doing distal points for this, and the major points in the body actually are below the elbows and below the knees. But sometimes we can use them on the mid aspect of the upper leg as well, of the thigh, and this is where that point is, Feng Shui, gallbladder 31.
Okay.
So very safe during this time of pregnancy as well.
Now, Western medicine, and modern science will always tell us, stress causes everything, or stress complicates everything. And I know with many women, the third trimester, maybe more so with their first child, or because of other circumstances, the stress, the anxiety, the worry, everything gets to the point. Can the acupuncture, in your opinion, can it deal with that as well, and then indirectly sort of help the skin?
Yeah, absolutely. So because stress can be a factor, and stress can sort of generate or exacerbate these conditions a lot worse, I think we've talked about it before, but we've used other popular points of yours and mine, yin tang, in between the eyebrows there.
Great for all types of worry, anxiety, stress, anxiety, absolutely. Insomnia.
Yeah. And just that overwhelming emotional response. So really good for any time during this period.
Yep.
And it's easy to get to, and it really does. People really do notice a difference when we do put it in, and they do leave feeling a lot clearer and a lot calmer within themselves. So yeah, it's very good.
Very good, very good. And I think there's actually quite a bit of research that is being done and has been done, just confirming the efficacy of acupuncture in the treatment of mental, emotional, stress, anxiety, and so forth. But I think we're just running a little bit short of time, so we'll probably need to finish up here. But we'll get you back again. We've got a whole series of shows lined up with Kane, talking about a whole host of different women's complaints. So we look forward to that.
No problems. Yeah, and thanks for having me on the show again.
And why don't you just very quickly just give us your landline number for your clinic in Hamilton there?
Okay, so landline number or mainly the contact number is 027 499 831.
Okay, great. All right, and then what I'll do is I'll also put a link to your clinic. Connect Therapy is up on the comment section in the YouTube, so people will be able to find it there. All right, we'll see you next show. Bye.
Awesome. Thanks very much.